Welcome to arirangtv's special coverage of COVID-19. I'm Min Sun-hee. Now, despite the spread of COVID-19 worldwide, efforts to establish a new normal continue with the focus on safety. Here in Korea, beaches have opened doors in light of the summer, and we have details on their measures to prevent infection with our Kim Da-mi. But first, we have the updates on the pandemic with our Kwon So-ah. So, do start us off with the local updates. I hear there's been an uptick in cases here.
Yes, Sunny, we have more than 60 new infections today, and that really calls for vigilance over the weekend, wherever you are in the country, because sporadic cluster infections are continuing, and those have resulted in 52 local transmissions today, and that marks the 5th time that we're seeing a number above 50 when it comes to local transmissions since the country shifted to the everyday social distancing scheme. And with that, let's take a look at the figures. We have 63 new cases. That includes 11 imported cases and brings the total to 12,967. And we have 282 fatalities. And this number remains the same since last Friday, so for the entire week. And 926 people are still in quarantine, while 11,759 people have fully recovered from the disease. 75 additional people have been discharged from hospitals or treatment. And it looks like for the 3rd consecutive day, we've had numbers above 50, as you can see here. And also the concern is that this number has been steadily rising over the past 3 days. And let's take a look at where the new cases emerged. Here we see that around half of today's new cases were concentrated in the metropolitan region, with 12 in the capital Seoul, 18 in Gyeonggi-do province, but then also a new outbreak here in Daegu with 13 new cases, and that had been the earlier hotspot early this year, and also here Gwangju in the southwest of the country with 6 new cases. And across the world, the situation is looking even worse. So we have more than 181,000 additional cases, bringing the total to 10.98 million. So probably on the weekend, we will have more than 11 million cases. And more than 5,000 people have lost their lives in the span of 24 hours, bringing the total to 524,039. And we have now 6.1 million full recoveries. Now, an exponential surge in cases in the U.S. here at 2.8 million, and that as the U.S. has been seeing more than 50,000 cases on a daily basis. And Brazil here with 1.5 million cases and more than 61,900 fatalities, and Russia and India here both in the 600,000s. Peru, meanwhile, its fatality has surpassed the 10,000 mark. Let's take a look at our next table. The biggest surge we had here in Mexico, which added more than 6,700 daily cases, bringing the total to 238,511. And those are the updates I have for now, but I'll be back here after the government briefing. Until then, back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Now, efforts to ensure a new normal have also been extended to cover our summer leisure activities. As mentioned at the start of the program, beaches across Korea are ready to welcome visitors, but under a strict safety guideline in light of the pandemic. For more on this, I have our Kim Da-mi here in the studio. Welcome, Da-mi.
Good afternoon, Sunny.
Right, Da-mi, so do tell us about the new normal at beaches.
Right, now that the summer has come, those who are eager for a taste of summer are heading to the beaches. And the local beaches are preparing for a long, hot summer with strict virus prevention guidelines. First comes first, temperature checks. Visitors to beaches in Gangneung must get their temperatures checked and are given wristbands to show they don't have a fever. Sokcho Beach in Gangwon-do province will in fact install automatic disinfection systems that sense and spray disinfectant on visitors, and areas with no disinfectors will be blocked.
Disinfecting machines will give all visitors that feeling of safety, which is the most important, and the machines conduct the basic sterilization.
Just out of curiosity, Tami, how are beaches planning to deal with the possibility of overcrowding during the summer?
Right, to prevent overcrowding at the beaches, there's an online color-coded alert system that will show how crowded beaches are. A green light indicates that the number of people on the beach is under the recommended level. That's a maximum of 1 person for every 3.2 square meters of beach. Yellow is between 100 and 200% of that figure, and red over 200%. And the alert system is updated every 30 minutes. 10 major beaches across the country have already implemented the system since Wednesday, and 50 other beaches will adopt the system by mid-July.
Right, and I also hear some beaches have launched reservation systems. Please tell us more.
Right. So you can actually choose which beach you'd like to visit, on what day and at what time, and the number of people you're bringing. In fact, those who are going to the beaches in Jeollanam-do province must reserve their beach spots. You can do so on the government official website, cntour.com, or the portal site, Naver. You can print out the reservation or simply show it on your phone on the day of your visit. After getting your body temperature checked, you're ready to enjoy the beach. Of course, it's impossible to stop people from coming without a reservation, but such a booking system could be one effective way to keep track of visitors. And the government plans to expand the adoption nationwide if the system is successful.
Hopefully it will bear fruit. It's quite innovative, I suppose.
Right.
What other safety practices are in place at these beaches?
So, of course, practicing social distancing is a must on the beach too. And the country's QR code-based registration of visitors comes in handy. Visitors have to show a QR code on their phone in order to use beach facilities such as showers and restrooms. And at beaches in Sokcho, only 7 people can use the showers for 8 minutes at a time. Busan City and Jeju Island will limit the number of parasols on local beaches, and visitors, of course, will be required to keep a certain distance from other parasols. Of course, local beaches will continue to remind visitors to practice social distancing.
Now, tell me, before you go, do you have any other more advice, that is, about how we can enjoy our day at the beach this summer?
Right. I don't know about you, but I personally enjoy more secluded beaches, and if you're one of those people,
I am.
You can simply check out more serene and peaceful beaches that have been designated by the Ministry of Oceans and Fisheries. And that includes 5 beaches in Gangwon-do province like Dobong and Sacheon, 6 beaches in Jeollanam-do province, and 5 in Gyeongsang-nam-do province, including Okge and Namildae. And I can tell you, I've actually visited Namildae, and it's quite serene and peaceful. And for more, please refer to the government's official website, cntour.kr. And one more reminder, unfortunately, beaches will be closed at night, and there'll be no summer beach festivals this summer.
Rightfully so, of course, to ensure the health of the public. All right, Tami, thank you very much for that coverage. Hopefully we'll see you soon.
Sure.
Right, we are now poised to join the regular afternoon briefing on COVID-19, and while we wait for that to commence, here are some related news. Korea's Football League has decided not to open its stadium to fans on July 10th as initially planned, given the recent rise in new cases across the country. The 2020 K-League season kicked off on the 8th of May in the absence of spectators, but had been planning to welcome fans back next Friday under stringent quarantine measures. Meanwhile, in the city of Gwangju, some 330 kilometers south of Seoul, all 438 schools there have been ordered to close for 2 days, that is until today, and to hold online classes instead in light of the double-digit infection numbers in recent days. Gwangju reported 12 cases on Wednesday, 22 on Thursday, but noted a drop to 6 cases on this Friday. But regardless of that, authorities fear that the city of 1.5 million people might become the new epicenter, as it took the city of Daegu just a week to see its caseload surge from 20 to 200. Most of the cases in Gwangju are linked to social gatherings at churches and a Buddhist temple. Now, social distancing measures in the city have been raised to level 2, banning indoor gatherings of more than 50 people and outdoor gatherings of more than 100. Also, for the next 2 weeks, public and multi-use facilities such as libraries and museums, as well as high-risk venues such as singing rooms, will be closed. Now, we are still waiting for the briefing to start, and perhaps now we can take a look at the everyday quarantine measures that we are recommending for you. Do remember to stay at home for at least 3 to 4 days if you are sick, and should you suspect that you may have been exposed to the virus, do get yourself tested. Stay 2 arms length away from others. Avoid congested and crowded places, of course, if you can. Wash your hands for at least 30 seconds and cough into your sleeves. Now, these are basic safety hygiene practices to ensure your health and that of those around you. Ventilate twice a day and disinfect regularly. If you're using the air conditioner at home, make sure to ventilate your space at least once every 2 hours to keep your health. Now, we're still waiting for the briefing, and we'll take a look again then at the numbers for this Friday here in Korea. As reported by our Kwon earlier, we have 63 new cases on this Friday, raising our total here in the country to 12,967. Fortunately, for the past 1 week, we have not seen our death toll change. It remains unchanged at 282. We have 12 people who have been released from quarantine, and we have 75 people who fully recovered here in the country, raising our full recovery total to 11,759. The briefing is expected to start in a little while. I'll come back to you with the key announcements, a summary of that with our Kwon later.
First, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of July 3rd, Friday, we have 52 new local infections and 11 new imported cases. And the total number of confirmed cases now stands at 12,967. And 75 more people made full recoveries, and out of the total, 90.7% have been discharged, and a total of 926 people remain in quarantine. The death toll remains unchanged. And here are some updates on the major domestic infections. At an apartment complex in Ujeongbu City, Gyeonggi-do Province, there was 7 additional cases being confirmed at a gym that this person has visited, and the total now stands at 21. And 9 of them are related to the apartment complex, and the rest are related to this sports facility. And as for the Daegu's high school student, after being confirmed, we also have more cases being confirmed at an academy that she went to, and we also are conducting the epidemiological investigation for about 1,000 persons at the school. And in relation to the Gwangju Gwangnuksa Temple, we have a total of 57 cases, with 8 more cases being confirmed today. And also we had 4 people in relation to the Hanul Nursing Hospital, and also Kumyang Buildings, and also Gwangju Love Church. And yesterday we had 11 new imported cases, and as for the countries, 6 were from America, 5 from Asia, and 3 from Pakistan, 1 from Kazakhstan, 1 from Russia. The KCC, we witness current cluster infections, and we highlight the Ridgeway in Seoul, which was a door-to-door sales, as well as these door-to-door sales in Daejeon. We have some table that we have prepared, and in relation to Ridgeway, we have 210 people who were confirmed. 42 of them were direct visitors, and this led to fifth-hand infections, and a total of 168 further infections have been confirmed. And there were 3 additional businesses that have been exposed to the virus, and 4 churches were also exposed to the virus as well. Most of the people were over age of 50, and they accounted for over 70%, and therefore we had 2 unfortunate fatalities. And we also have 19 critical condition stages, and we also have 1 person going through critical treatment. And as for the Ridgeway, we also did an analysis of the further infections. The most dangerous activity that they were engaged in was singing and chanting in an enclosed and crowded spaces. And most of the people, as for the direct visitors, they were also first exposed to the virus at the PR session, and they also went to multi-use facilities, and we believe that there were fifth-hand infections through the course of about 10 days. And at the door-to-door sales in Daejeon, we identified that 3 such businesses were exposed to the virus simultaneously, and a total of 81 people have been confirmed. And there were 35 people who were direct visitors, and we have 46 people who were the additional contacts. And we also witnessed a fifth hand of infections, and 11 of them were reported at the business facilities. And we also had the virus leading to nursing hospitals as well as other clinical centers. And also we had a high exposure to the virus among the elderly people, with 80% of them being over the age of 60. And also we have those in the critical conditions as well. And many of them had social gatherings. They stayed there for quite a long time. And also most of the virus were exposed at the business establishment. And they also had social gatherings. And also these included hair salons, restaurants, as well as saunas and hospitals. So they also spread through diverse cities as well. And we can learn that life quarantine measures like wearing a face mask is very crucial. And second, if you have suspicious symptoms, please refrain from going to gatherings or going outside. If you do so, even if you have symptoms, many people neglect the danger of such symptoms, and we identified that these people have spread the virus to others. So if you are not in a hurry, so please do refrain from unnecessary social gatherings. And on the 4th page of the press kit, we have some networking table that we have made. We can see that the virus started from one person. However, it spread to over 200 people in just 10 days. So this is shown in a diagram, and it also is spreading through diverse business associations and other gatherings, and we have made this into an image to help your understanding. And as we combat the COVID-19, we are tracing the contacts, and we are putting them on self-isolation, and these are some preventive measures that we are taking. However, there are many people with no symptoms or with little symptoms, so it is very important to have social distancing with each other and refraining from going to social meetings and abiding by personal hygiene measures, including wearing a face masks and hand washing. So these are some of the very crucial and fundamental measures in order to prevent the curve of the virus. And looking at the cluster infections in Gwangju City, we have similar trends that are being witnessed. We are seeing the virus being spread fast through religious centers, the places of worship, and which is also spreading to other door-to-door sales businesses as well as nursing hospitals and hospitals. So we need to take extra precaution. This is very crucial. And as for the door-to-door sales, we have said many people did not wear face masks, or they did not abide strictly to the quarantine measures, and they also stayed at an enclosed, crowded space for a very long time under the purpose of sharing their information of the products. And also they engaged in activities that increase droplets to travel in air, like singing and eating together. And there were also many people who visited these group meetings even though they had symptoms, and the virus also spread fast among the community. In order to curb the further spread of the virus, especially among the elderly citizens, we ask the elderly citizens to avoid going to these information sessions that are held by these door-to-door sales. And it is very important to cancel your social gatherings, and please refrain from chanting or singing together in enclosed and poorly ventilated spaces. So if you have symptoms, it is very important that you visit the clinical center to get tested as soon as possible. And the KCDC, we would also like to highlight that during the weekend, we ask the religious facilities to take particular precaution because during the weekend, we will have a high risk of infection, especially at the places of worship. And all of the religious small group meetings and religious events need to be switched to non-face-to-face methods. And in case of an unavoidable on-site event, please reduce the number of participants, and please keep at least 2-meter distance, and please wear your face mask, and please do not sing together and just have instrumental music instead. And during the weekend, we believe that many family outings will also take place. And when you go to enclosed space like restaurants, if you need to make a phone call or answer a phone call, please go to the outside and always wear your masks. The KCDC, we would also like to help the companies that develop the diagnostic testing kits, and to help them, we are also intensifying our support. And we are trying to cultivate about 1,700 samples for those who have tested positive, and these will be cultivated and collected. And these are the remaining specimen that we have accumulated from the patients. And also we have many institutions that have applied for this process, and they will be cooperating with the 18 diagnostic testing kit developing countries, and they will be also administered in the process. And in this process, the KCDC will exert our full efforts to increase the accuracy of the test kits, and we believe that this will contribute to intensifying the quality going forward. And the Korea Research has conducted a latest survey on COVID-19, and about 70% of these respondents have said that the COVID-19 condition here in Korea is deemed serious. However, on the other hand, 13% of the people said that they had risks of infection. In other words, they see, and many of them see, that this is a social trend rather than a disease that they themselves or their family members could get infected. And we also have concerns that such a perspective could lead to complacency among the public. And right now, the COVID-19 outbreak is spreading through the metropolitan area to the middle region, and now down south to Gwangju and Gwangju city. And it is also intensifying through the religious centers, and it's spreading to nursing hospitals, nursing facilities, and other medical clinics. And please note that COVID-19 spreads fast among asymptomatic patients, and it is very difficult for us to trace the contacts. And please note that if there are crowded spaces, this place could be prone to the infection. And also, please note, if you are at closed, crowded, and close contact facilities, you are also vulnerable to COVID-19 outbreaks. So make it a habit to abide by strict quarantine measures, including face masks. And during the weekend, please remember and please be aware that you yourself could become victimized to the COVID-19, and you could also spread the virus to your loved ones as well as your colleagues. So please practice personal hygiene measures. Thank you very much.
Right, that was Chung Eun-kyung, the head of KCDC, with Friday's afternoon briefing. So do give us a summary of the key announcements.
All right, well, let's start with the government's recent in-depth analysis on door-to-door businesses, which were high-risk facilities. And according to Chung, the Richway door-to-door business establishment in Seoul has a total of 210 cases that are linked to that facility. And also there were chain transmissions by even 5 stages. And also in Daejeon, there were 3 door-to-door businesses that had in total more than 80 cases. And the similarity between these 2 cases is that people above 50 accounted for over 70% of the total cases in Seoul and over 80% in the cases in Daejeon. So that really shows how elderly people are affected, and especially these crowded facilities are high risk, which is why Chung again stressed over the weekend to abide by social distancing measures, especially when you're going to religious services.
All right, so thank you for that. We'll see you again next Monday.
See you on Monday.
Staying on the local front, along with the opening of beaches across the country that we touched upon earlier, is that of water parks. So how are safety precautions being carried out there? I have our reporter, Chun Song-cho, at one such water park to answer that question. Hi, Song-cho.
Good afternoon, Sunny.
Song-cho, please start by telling us where you are.
Yes, today certainly doesn't feel like work for me because I'm at Caribbean Bay, South Korea's largest water park, located in the city of Yongin, just southeast of Seoul. July has rolled around. Temperatures are hovering above 30 degrees Celsius. Well, if it were a normal year, then people wouldn't think twice about jumping into the pool, right? But since the COVID-19 pandemic hit the country, enjoying the summer has become a lot more complicated. Well, South Korea blunted an initial surge in infections in February and March, but it has continued to see a small but steady number of new cases, especially around crowded spots. So water parks like Caribbean Bay, where I'm at right now, are taking extra precautions to allow visitors to splish and splash through the summer without worrying about contracting the virus at the park while doing their favorite water activities at the park. So speaking of Caribbean Bay, it has reopened its doors to the public on June 5th, and it was able to do so because it has really strict guidelines to prevent transmissions of the virus. Well, you might have noticed there are only dozens of people inside the pool right now. Usually there are hundreds this time of the year. This is when the park gets really packed with people because of the heartwarming weather. But then I only saw like a handful of rubber floats coming down the giant slide now and then. And this is because the park has implemented a lot of measures, and it has limited the number of visitors to the park to less than 1,200 a day. Well, the pool itself is not a major factor for spreading the virus, but the parks are taking no chances, and this is certainly not the time for complacency. So once people are inside the park, the number one rule that people have to follow is you have to keep distance from people, because you have to think about all the time that people spend outside the water, right? Like lining up for tickets and changing clothes at locker rooms. So you have to keep distance from other people. And everyone is required to wear protection face masks at all times, well, except for the time when people are not dipping their toes in the water. So what happens to the mask when people are having fun in the water? It goes straight into these plastic bags that have been provided by the parks so that you can keep the masks dry while you're having fun in the water. There's so many other restrictions and measures that the park has implemented. So for more on that, I'm going to speak directly to one of the officials from the park here with us right now in the afternoon. Mr. Park Tae-young is here. Thank you for joining our show.
Thank you for having me.
All right, so I'm sure many of our viewers want to be reassured about their safety before visiting the park. So what can you tell them about what the park is doing right now?
First of all, we have reduced the number of people allowed to enter and have implemented a mobile medical examination for everyone entering the water park. And we also check temperature upon entrance to prevent infected patients. And we use an automatic measuring instruments for swimming pools and spas to check water quality and surveillance. For a safe and stable operation, we focus our attention on disinfection and quarantine. Yeah, thank you.
Wow, that's a long list of things that the park is doing. Thank you so much for your time. Thank you. Well, extraordinary times require extraordinary measures, right? And I'm sure many people might feel frustrated and impatient because of all these extra steps that they have to take. But let's not forget that because of this protocol, we have the freedom of visiting the park amid the COVID-19 pandemic. Well, this has been Chun Song-cho reporting live from Caribbean Bay in Yongin, and now back to you guys in the studio.
All right, Dongseo, as you said, public priority on public prevention amid the pandemic this summer. Thank you for your report.
This is not even close to being over. The pandemic is actually speeding up.
It took COVID-19 6 months that is, to infect more than 10 million people across the globe. What's more, it continues to spread aggressively, and new research claims that a specific mutation is making it even more infectious. For more on the status quo, I have Dr. Lee Han-sung from Severance Hospital. Welcome to the program, Dr. Lee.
Thank you for having me.
And I also have Professor Justin Fendos from Dongseo University. Good to see you again, Professor Fendos.
Thank you for having me.
Dr. Lee, let's begin with a brief assessment of the current COVID-19 situation here in Korea.
Well, I'm afraid that we are heading into the second wave of the pandemic a lot sooner than we had expected. It seems that the current measures cannot keep the rise in infection from overseas and the sporadic outbreak in check. What is concerning is that things might get worse as soon as the vacation starts.
I see, so you have quite a bleak outlook then.
I do.
Do you share this bleak outlook, Professor Fendos?
No, I don't. I think I'm more of an optimist on this. And I feel like when you look at the numbers, whether you look at them in absolute terms or relative terms, the numbers are actually quite small. And obviously, we've had an uptick in cases compared to a few weeks ago. But when you compare it to the hundreds or the thousands or tens of thousands we're seeing overseas, Korea has been doing a very good job in keeping those numbers very low. And this is really a testament to the really aggressive contact tracing procedures that are in place and the political and cultural willingness to follow through with a lot of these mitigation protocols, as well as mobilize hundreds, if not thousands, of police officers to round up all these contacts of new patients and bring them in for testing. So at this point, I am still cautiously optimistic that everything is still under control, but obviously you'd prefer to have fewer cases.
Right. Now, despite the optimism advocated by Professor Fendos, of course, there are people like Dr. Lee yourself who are quite concerned. What are your thoughts, therefore, about raising Korea's level of social distancing to 2, like it is the case in the city of Gwangju right now?
I think, considering the current situation, the call was right. Raising the level 2 in Gwangju was the right decision in many ways, because raising to level 2 means tightening the regulations for social distancing, which will hopefully curb new infections. But the government has to be flexible about the target numbers, because when you set a target number, you can't wait until infection reach that target number, and you certainly can't observe the trend for 2 weeks. That's pretty dangerous on my part.
I see. So, right, the idea first, of course, was to see whether a certain number would reach a particular threshold for for 2 weeks, of course, and then to raise the level of social distancing.
Yes, I think.
And for level 2, we would have to have the number standing at over
50 to 100, yeah.
For 2 weeks then.
2 weeks, yeah.
And if the number exceeds 100 for 2 weeks, we would have level 3, of course.
Yes.
I see. Professor Fendos, on a different note, what do we know about the mutations of COVID-19, and should we be worried?
Yes and no. So we have a lot of information now about the mutations. And first, to comment on the speed of the mutation, it's not that much faster than other similar types of viruses, but neither is it any slower. So the rate of mutation seems to be about average. So far, we have isolated about 20 or so different types of mutational variants across the world. And most of them don't do very much. They don't increase the virulence or anything like that, except for, unfortunately, one type, which is the D614G variant. And unfortunately, this particular variant, even though it only changes a single amino acid, which is chemically speaking a very small change, it really changes the reactivity of the virus quite a bit. And we've had some very recent cell studies where we've put this new variant virus on different types of human cell lines, and we found that it's able to infect both lung cell types, intestines, the blood vessel cells, as well as heart cells more quickly than the original variant. And this is not good news because, especially for adults, we rely on our adaptive immune system to respond to new viruses that our body has not seen before. And so that process of adapting to a new virus takes some time. And so if the virus is very quick and can infect our cells very quickly and do a lot of damage before our body is able to mount a response, that means that we're going to have a lot more symptoms before our body is ready to fight it. And so we've had a lot of circumstantial evidence connecting the new variant to higher death rates. It's circumstantial evidence, so not concrete yet, but given our understanding of how the adaptive immune system plays a role in this, it seems quite likely that when all the data has come out, that we will see a strong link. And one other thing to mention is that this new variant, the more attacking virulent form, has more or less taken over all of the populations of the virus that we're seeing. So it is now the dominant form of virus that we observe in just about every country, which also says something biologically that it is a stronger, more robust virus, better at infecting human cells than the previous version. So, if we want to say it in simple terms, the virus unfortunately has gotten an upgrade.
I see. Now, earlier on, we were able to talk to one of the senior authors of the study that showed the mutation that Professor Fendos talked about, the D614G, and it showed that it can greatly raise the virus's ability to infect cells, like Professor Fendos said. Now, this is what Professor Arirang from Scripps Research had to say.
So what he found was that first, as I said, we used this proxy virus with the mutated and non-mutated form and infected the cell culture system. And we found that the one with the mutated spike protein infected the cells with nearly 10 times higher efficiency. So infectivity was significantly increased. And we further studied to see why that happened, what in the virus changed. And we found two things. That is, spike protein stability was increased. And secondly, spike protein density on the virus was increased. So now the mutated virus has more spike protein that are more stable. So now this virus has an easier time to attach to the target cell. The vaccines that are being developed currently are based on non-mutated virus, right? And those vaccines are going to be still effective against the mutated virus. We already know this answer because we studied it. So far, so good. So we don't need to worry about currently developed vaccine for this particular mutation. But that doesn't necessarily mean that in the future, when we have other types of mutations, especially in the spike protein, all the vaccines are going to be fine with those mutations. So yes, it is better to have as small size vaccine as possible. What I mean is that this spike protein is a really large protein, and antibodies are generated against the whole spike protein. And mutations can happen anywhere in this step 800 amino acid. If we use only a small portion of this protein as a vaccine, then chance of a mutation happening in that small portion is going to be decreased, right? So that is one thing we should keep in mind. But for this particular mutation, the vaccines being developed will be fine, will be effective.
Now, Professor Fendos, despite what Professor Chair just said about the current efforts to come up with a vaccine for the COVID-19, what are your thoughts about how those seeking a vaccine should move forward with their efforts, given the possibility of greater mutations in the future? Right.
So she gave a really great explanation about how normal, traditional, conventional vaccines will be unaffected because those vaccines are developed on the premise of trying to attack all parts of the virus, not just a small portion. So for those types of vaccines, the research can proceed as it has, and even if you get small mutations at certain spots, it really won't affect the overall outcome. But for some other types of treatments like antibody treatments, where you're trying to make antibodies that are specific to just one part of a particular viral protein, those might, if that spot mutates, then those antibodies won't work as well. So it depends on what type of vaccine, what type of treatment we're looking at.
Right. Dr. E, please tell us a bit about the use of remdesivir to treat critically ill patients.
So it's still a drug under investigation. Some studies suggest that if given early in the course of the disease, it can affect the outcome, but it needs validation, and it will be validated through many of the clinical trials to come. As for the safety profile, it's relatively safe, only causing mild liver damage, but I haven't seen or heard any reports about any severe side effects that would cessate the administration of the drug itself. And from what I heard, the eligibility criteria for taking that drug in Korea is pretty strict. So you have to meet 4 strict criteria to get the drug. And my understanding is that only a handful of patients meet that criteria.
So we are being very cautious with the use of this anti-Ebola drug then?
Exactly, yes.
I see. Dr. A, apart from treating, tracing is also a very important part of Korea's containment strategy.
Right.
Now, with this in mind, what efforts can be made to ensure greater ease in the use of the QR registration system at high-risk facilities?
Well, from a user standpoint of view, it has to be user-friendly, especially for the older generation or people who are not technologically savvy. It has to, the government has to support the business owners as well, providing with the equipment and the financial support. I think, the message you want to deliver to the people is that the data that's been collected is stored safely, accessed with responsibility, and will be deleted upon expiration.
Right, which should be about a month, is it?
Is it? Yes, it's 4 weeks.
I see. Professor Fendos, the saying goes, when it rains, it pours. And as though to testify the wisdom of this adage, a new swine flu has been discovered in China. Researchers have said it has no relation to COVID-19, but there is a possibility of this new flu virus creating a pandemic. Can you tell us more about this?
Yes. So the last significant swine flu that we had was in 2009. At that time, the virus was the H1N1 virus. It ended up killing about 300,000 people, mostly in China. But after that incident, the global community started installing observatories at different pig farms throughout the country in China to try to get a handle on what kind of viruses there were there, how the viruses are changing, and how those viruses may or may not be jumping into the workers, the human workers in those environments. And for the first 5 or 6 years, the project didn't see a whole lot, but in the last 3 years, we've seen one particular strain start to become dominant, a lot like that mutated version of COVID has become dominant globally.
The D614G.
That's the one.
Okay.
That's the one, yeah. And so this new variant of the swine flu, which is called H1N1. So it's a combination. It has genetic material that's both from the old H1N1 virus as well as Eurasian avian flu virus. And that combination is not rare. It does happen quite often. But this particular virus now seems to be very dominant in these pig farms and also seems to be responsible for a lot of the respiratory symptoms that the pigs are seeing. But the most disconcerting part is that about 10% of the workers have been found to have antibodies against this virus, which means that they've already been infected. Now, so far, we haven't seen any deaths associated with it. We haven't seen any severe human symptoms associated with it. But the problem is you have this very unique environment where you have a lot of the virus and the virus is jumping out into human hosts very easily. So that gives a really nice environment for the virus to acquire additional mutations that may make it more virulent and start another pandemic. So it's not an imminent threat, but it's definitely something we want to deal with sooner rather than later.
Of course, I see. Professor, Dr. Lee, we are looking at a reality where COVID-19, our battle against it, is looking to be a prolonged affair. Now, given this reality, what efforts can we do as ordinary citizens to ensure a greater sense of safety?
Well, let me start with the government. The government has some hard choices to make in the future. They must decide whether to stick to this containment strategy forever or shift to a mitigation strategy. The current containment strategy is exhausting a lot of resources, and we only have limited ones. As for individuals, I think the best way is the ones, given the guidelines from the CDCH. You should always wear your masks, avoid mass gatherings, and frequently practice personal hygiene. This is especially important when the prospect of vaccine development is still not bright.
Right, I see. Professor Fendos, what are your words of advice in light of this protracted affair of COVID-19?
Right, so I'm still a little bit more of an optimist about the containment strategy. And, again, especially given how big the population in Korea is and how dense the population is, I actually find it quite amazing that we still only have 50 or 60 cases at this point. Obviously, you'd like less, but I'm still blown away that that's possible. Obviously, there's a trade-off here. So if you start going the mitigation direction and closing things down, there's going to be an economic hit that you're going to get. So as Dr. Lee correctly says, there is a balancing act that you have to have, right? Because you can't close everything, but at the same time, people need to make money and so forth. So I think one of the things that I'd like to mention is that the mentality is really important. So a lot of people still, they're thinking, how can I protect myself? I'd like to flip that around and suggest the real important mentality is, how can I protect other people? And it turns out the things that you're going to do for both of those things are very similar. Wear masks, wash your hands, disinfectant, social distancing. But that extra mentality of thinking about those people around you, if everybody did that, everybody would be a lot safer. So I really think that that mentality is really important. And I hope Koreans keep having it, because they've had for the vast majority of the time so far.
Right, thank you for your positive words.
Thank
All
you.
right, Professor Fendos, as always, thank you for your thoughts. And Dr. Lee, thank you for being with us today.
Thank you for having me.
Right, that brings us to the end of this week's edition of COVID-19. We'll be back on Monday with more on the pandemic here and elsewhere around the world. In the meantime, do reach out to us with your thoughts and inquiries through our social media accounts or homepage, arirang.com. Do have a safe weekend.